Hello, our presentation is on Marfan syndrome, and our group participants are Cassandra Moya, Cassandra Ortega, and Morgan Perry. What is Marfan syndrome? Marfan syndrome is a disease that is autosomal dominant, and it actually happens once in every 10,000 to 20,000 individuals.
The signs and symptoms vary. For Marfan syndrome, typically you see somebody who has longer arms, longer legs, longer fingers. It's all very disproportionate to their normal body size. Their feet are flat. They have a curvature to their spine. There is also a tall, thin sort of body structure. They suffer from glaucoma, cataracts, aortic enlargement, lung collapse. They have a protrusion to their chest. And there's also some abnormal heart sounds, and their joints are very hypermobile. Helps. And we've talked about Abraham Lincoln in the past, in past lectures, so we kind of have a better understanding about him with the character who played Chewbacca. He actually stood at 7'2", and as a result of his Marfan syndrome, he died from heart complications, and at one point he had spinal surgery to help improve his mobility. Looking at Michael Phelps, he too had the long limbs, fingers, hypermobile joints. He constantly has to monitor his heart rate just in case anything happened.
Air pockets near the top of the lungs.
There are treatments for Marfan syndrome, but there are no known cures for it. Many people with Marfan syndrome deal with hypertension and beta blockers, or also known as beta-androgenic blocking agents, or medications that reduce your blood pressure. Beta blockers work by blocking the effects of the hormone epinephrine, also known as adrenaline. Beta blockers cause your heart to beat more slowly and with less force, which lowers blood pressure. Without beta blockers, the aorta could potentially burst from all of the blood pressure. Eyewear such as eyeglasses and contacts are used for people with Marfan syndrome because abnormalities of the eyes usually occur, which can lead to vision loss, dislocated lenses, and possibly cataracts. Treatment for curvature of the spine, scoliosis, will depend on how severely your spine is curved. If your spine is mildly curved, your treatment team will closely monitor it to see whether it gets worse. In some cases, particularly in children who are still growing, a back brace may be recommended. The brace will not cure scoliosis, but it will stop it from getting worse. There are some situations in which people with Marfan syndrome need surgery. One of them is aortic dissection, and it's a medical emergency in which the inner layer of the large blood vessel branches off the heart and the aorta tears. Another situation is an aortic aneurysm, which is a balloon-like bulge in the aorta artery that carries blood from the heart through the chest and torso. Aortic aneurysms can dissect or rupture. The force of blood pumping can split the layers of the artery wall, allowing blood to leak in between them. This can also result in an aortic dilation, which means that the ascending aortic diameter reaches or exceeds 1.5 times the exceeded normal diameter. There can also be breastbone correction, which is a surgery to fix the shape of the bone in the middle of the chest, called the sternum or breastbone, so that the lungs and the heart are not squeezed by the inward curve of the chest. Then lastly, there can be laser eye surgeries for better vision for people with Marfan syndrome. Our genetic disorder was Marfan syndrome, and it is an autosomal dominant disease, and just all of us as a group chose it together since we found it as a way to learn something new about a different genetic disorder since none of us knew anything about it, and even the name altogether was just a bit intriguing, and just overall just none of us knew anything about it at all. I had never heard of it except for in class, and as the same goes for my group members, and we all felt the same way, and we wanted to just learn about a different genetic disorder.